I'm going to be breaking down today this script from Acement because apparently it's one of the best scripts out there, or one of the better ones. So let me take a look on this. I'm just downloading it, so it's better for making the video. Going
Today
back to
we're
my
going to talk about how to repair sciatica, which is the most common pain my patients have come to me with in the last 12 years. So I thought,
check.
today we're going to
Today we're going to talk about how to repair sciatica. I'm not so sure if I like this script, if I like this headline that much.
we're going to talk about
Alright, but this one is really good. There is this highlight of this. I'll make this a little smaller. Catchy hook. Catchy visual hook. Pulsing image. Alright. Then they didn't forget to put the headline, obviously, or the text overlay. They have a text overlay with the weird word highlighted in red to make the message stronger. Let's continue.
how to repair sciatica. Today we're going to
Then we have
talk about
these.
how to repair.
This is also very good. There are arrows pulsing right here on this image to highlight it even further. Let's continue.
Sciatica, which is the most
Then this one is very good. So they're highlighting the pain in the body to make it a little bit stronger. So this sentence so everybody could have that.
common pain my patients have come to. Me with in the last 12 years. So I thought I'd record a quick video explaining a very simple yet effective stretch that
Long
actually
time.
solves the root patients have come to me with in the last 12 years. So I thought I'd record a quick video explaining a very
So the B-roll.
yet effective stretch that actually solves the root cause of this condition. About 98% of the patients that I've recommended this solution to got rid of their back, hip, and leg pain in about 7 to 10 days. Let me explain.
Alright, this is interesting. Patients that I have recommended this method to, what he's saying is pretty much, here is a method that solves this to almost anybody. I'm sure that this guy didn't went to and be like, how many percent of my patients of all of those that they recommended this to got rid of this pain? I'm sure he didn't do this. So what he's saying is, here's this method that solves this for almost anybody. 98%. That means you could be one of those people too. This is literally what he's saying. All right. So let's continue. What comes up next? And then he's saying one more thing. There is this one method that I'm going to show you if you're gonna continue. If you're gonna continue watching, if you're going to continue watching, there is this one method. Wanna hear more? All right, so this will be the thing. Let me explain exactly why and how. You see? So, wanna hear more? Let me explain exactly. He highlighted this word. How and why.
Why and how? What is sciatica, first of all? It meant
So he's also in this scrubs.
this.
So he looks a little bit more as a figure of authority. Wears doctor's coat to look more as a figure of authority. The thing here is, if you look at this enough, like no doctor in his doctor's office is going to wear this, alright? He's not gonna look like this. This is maybe like a surgeon or somebody that works in the hospital, my opinion.
Solutions who got rid of their back.
They got rid of their back, you see, so this is a really amazing situation here as well. Like, again, highlighting the pain. Highlighting the most common pain people have. Saying back and hip. Because if you think about this, most of the people complain about those things, not about joint or whatsoever, right? If they have problems that the product is solving, right? And the product is kind of a pillow that you put yourself onto and then you stretch yourself out. Let me check. See, so this is the pillow. Yeah, $12. They probably sell it for more. So let's just continue. Let's continue watching.
Back, hip, and leg pain in about 7 to 10 days.
So putting a time frame on this. Alright, so that will be the next one.
Hey, let me explain exactly why and how. What is sciatica first?
So, unique mechanism. What is sciatica after all?
It manifests as an intense pain that starts in your
Again, so there is in the whole video, in the whole ads, you can see like that the pain is being highlighted over and over.
lower back and radiates down your legs, usually in the back part of the leg. And it comes from the sciatic nerve, which is the longest and thickest nerve in our body. But why? Well, a healthy spine has a natural curve.
Okay, so what is happening in here? He's saying, what is sciatica after all? Explains the problem that the prospect might have and that he might be aware of. That means he says he might have leg pain, back pain, lower back pain.
I'll put a short video on the screen to show how a painless back looks. If our spines always stayed in this position, we would never have to deal with horrible back pain. However, as we age, our vertebrae
All right, so explaining. The spine has to be in a perfect position, but due to our everyday life, it doesn't. So you get pain. It's literally explained in one sentence. And then there is this video highlighting the vertebrae. Right, so very nice graphic explaining the vertebrae in a visual way. Understand what's happening.
To collapse due to pressure and lose that curvature.
Collapse due to pressure.
And when it's gone, the spaces in our spinal column get smaller and smaller.
Hey, here, do you hear that? When it's gone, then huge pain.
So if you have sciatic pain, chances are you lost the normal curve in your back. I'll show a comparison on the screen between a healthy spine and one that lost.
Comparison of those two.
Its curve. Now when we lose the spaces in our spinal column, the discs between our collapsed vertebrae get compressed and bulge out like a balloon.
Alright, this is a bulge out like a balloon. So the problem gets explained by Benta 4.
They basically slip out from between our vertebrae and put pressure on the nerves around our spine. And guess which big and long nerve is most likely to get pinched by a bulging disc? You got it. It's the sciatic nerve. And when a disc presses on it, it sends radiating, excruciating pain from our lower back through the hips, buttocks, and legs. I had patients that left their sciatica untreated for so long that they had to be brought in my office in a wheelchair. The pain gets so bad sometimes that it literally will not let you move. I'm sure some of the people watching know exactly what I'm talking about, unfortunately. Okay, now how can you restore that natural curvature in the back? Remember earlier.
So it's a very interesting one. If you don't treat it right now, this pain that you have, you could end up like my other patients that have had to be brought to my office on a wheelchair. So what can you do to prevent this? Here is the start of the unique mechanism of solution. So how can you solve this? How can you prevent this?
Earlier when I mentioned a very effective stretch that helped my patient.
All right, so there is this one very effective stretch that can prevent that.
Patients realign their vertebrae and release painful, trapped nerves
To
from under the pressure of bulging discs. What you want to do is lie down on a back-supporting foam, or
What you want to do? Lie down on a supportive foam.
I guess you can call it like a foam block. It's firm. It has to be. So that when you lie down on it, it puts enough pressure in the direction of where your spine should curve so that it restores its natural position. So obviously, we can't use pillows or rolled up towels. Let me quickly show you the exact.
All right, so you need to put enough pressure on the spine. We can't use other products that are similar. That means pillows, because the pressure is lacking.
Back support foam that I give to my patients. Here it is. It's called.
This is the pillow that I give to my patients. And it's a very interesting one because he says like, here is the pillow that I give to my other patients. It's called, and then he reads out of the
Here it is.
manual.
It's called the refresh stretcher. This is a very sturdy device.
All right, so introduction of the product. Here it is. Now what does this do? And now he lists
That can hold
features.
any weight on, and it's curved at an optimal 26-degree angle. So when you rest your back on it for 5, 10, or 15 minutes per day, it naturally decompresses and corrects your spine. Let me show you exactly how to do this stretch and where to place the refresh stretcher. And by the way, if you want to get the exact one that I recommend to my patients, I'll put a link below this video. This one is made by Aceman, and they do have a 30-day money-back guarantee as well. Anyway, let me show you. I'll put some clips on the screen of some of my patients so you understand how it works. You want to...
Alright, so there you go. Look what he is doing. If you want to get exactly the one that I recommend to my patient, so he's putting out the offer there, and he's just super softly like offering you this. He's not saying like buy this right now, it's limited. It's just like, yeah, by the way, if you want exactly the one that I recommend to my patients, then I put this link down there. So product in use, some of my patients. This is made very plausible. Very plausible usage of the B-roll.
If the floor is too uncomfortable, and then slowly lay your back down right at about your L2 or L3 vertebrae and keep your knees bent. It will feel a bit uncomfortable at first because your spine is no longer used to curving in the right direction, so don't be worried. I suggest you first try and rest your back for about 5 to 10 minutes per day until you get used to it, and then increase the time every day. Now listen up, this is important. After you lie on it for the first 10 minutes or so, when you get up, you will already feel relief from the pain. You'll feel a lot better.
Okay,
Why?
interesting. See? After the first 10 minutes you're going to use it, you're going to see immediate results. See?
It's not going to fully correct the curve. It's like you're stretching your spine into the right position, but then it gradually goes back, like an elastic band, right? However, there is some fantastic research and testing that my colleagues and I have done, which shows that if we were to increase the time you lie down on this thing to up to about 15 minutes per day, maybe even 20, your spine will readjust its optimal curve.
So here is a future pace happening. If you would lie on this for 20 minutes per day, based on this study that I have conducted with my colleagues. He's not even saying that, he's just saying, oh, I just discussed with my colleagues about how long would you need to actually completely readjust this. So it's like future pacing this, look.
Because it's like you're retraining the deeper ligaments in your back to create like remodeling, reshaping of your back. Of course, start with 5 to 10 minutes per day, then gradually go up to 12, 14, 15 minutes, because you'll see that when you stand up, your back may feel a little
I'm saying like,
stiff
what
and
if
sore, but realize that what you're doing is you're putting this healthy curve back into your spine slowly over time. So keep working on it every day until you hit close to like 20 minutes, because even
nice. So what you're gonna do is actually gonna do is increase the curve of your spine. Look at this.
we want to fix the root cause of the pain.
You can naturally fix your problem. We want to fix the root cause of the pain. It's pushing the customer into the desire. So it's like saying the desire. This could be probably even stronger if we would just say like, imagine a life you can live with this back to the normal. Yeah, like the real desire is what they want, right? The feeling that they're missing out of their life.
Pain, right? Not mask. Generally, my patients are able to realign and decompress their spine back into a...
This is now he's saying the testimonials. of the product. Generally, my patients are able to get back to healthy, natural position in
Position after about
7 to 10 days of using this magical tool.
10 days of using the refresh stretcher. And after that, I tell them to gradually use it less and less. And then keep an eye on their posture when they sit at their computer or watch TV. And that's exactly what I recommend to everyone who is suffering from sciatica and other pains that spread from their back to the hips. Hope you found this video helpful.
So I recommend this generally to everyone having this type of pain in XYZ, and the ABC. Mentioning like you are one of those people. Targeting.
If you want to get the refresh stretcher, click on the link below this video. And please don't forget, keep your back straight.
Alright, I don't like the... So there is the end caption, which is not bad. Not bad. But stronger call to action could be there. Alright, so that will be it.
See you next time. Today we're going